Hello, this is Coach Rashid again, and we are continuing the first chapter of this course about mental illness. We talked about some very specific issues that could cause mental illness, including genetic factors, environmental factors, as well as childhood trauma. We will expand on childhood trauma because it's a more complex, involved subject later on. We also talked in general about definition of mental illness versus mental wellness and how to classify that. Today we're going to talk about a very important subject, and this subject really applies to every patient, every family member, as well as any provider, whether they are prescribing medication, doing therapy, doing evaluation, etc. And that is the importance of ruling out other issues that cause mental illness. Two important subjects come to mind. One of them is physical or neurological illness. So there are a lot of different physical conditions that can present with mental illness symptoms and meeting criteria for the diagnosis of mental illness in addition or in the absence of physical accompanying symptoms. The DSM 5 and other DSMs before is very clear that you can have a, a complication of having mental illness symptoms when you have physical condition, and you have to treat the physical condition first to be able to address the mental health condition. In addition to that, substance abuse, any substance people can use, sometimes they are legal or illegal, including alcohol and marijuana that are legal for alcohol in all states and legal for marijuana in many different states. These conditions, whether you are using the substance or withdrawing from the substance, could mimic mental illness, and you cannot make a diagnosis of mental illness unless the person is not using substances or not in withdrawal of substances when you do the evaluation and make the diagnosis. Chronic illness is another issue. So, in addition to having physical conditions that presents with mental health issues, there are certainly many chronic illnesses that could affect the person's mental health and coping with their physical limitations, pain, and certainly associated with chronic illnesses. These chronic illnesses could be in any part of the body and could be any diagnosis. And the issue is related, like I said, to the degree of disability and dysfunction, whether it's vocational, personal, familial, relationship, that it could cause. Now, in this condition, we presume that the person has been diagnosed with the illness and is getting proper treatment, and then they still have a mental health condition, maybe depression, anxiety, even sometimes post traumatic stress disorder, and that will need to be treated. Of course, the treatment becomes more complicated as these patients maybe are taking other medications and treatment for their primary physical condition, and the interactions become an issue and need to be looked at very carefully. In addition, the impact of chronic illness on social relationships and daily functioning can lead to feelings of isolation, depression, anxiety, even if they are not to the extent of being diagnosed or needing intervention. We will talk about some of these factors in future presentations, but I hope this has been helpful, and any person, even family members and patients themselves, need to keep that in mind and start always by getting a physical assessment, and intervention is needed, and absolutely address sobriety and get in a sobriety program in addition to the mental health treatment. Thank you. I remind you that my website is Kosh Rashid, that's COACHRACHID.com. Please review the website, and if you like to talk to me individually more, you can book a meeting through that website. All the information that we exchange is completely confidential, and we will never use full names or any identifying information. Thank you.